Are you pregnant right now and telling yourself that you have to be strong no matter what? Are you convincing yourself that asking for help is a weakness? Are you pushing through pain, fear, and exhaustion because you believe you have no other choice? Are you alone in this journey and quietly hoping that if you just endure it, everything will somehow be okay? If these questions feel uncomfortable, that is not a coincidence. They are uncomfortable because they are real, and they describe the situation of many women who are pregnant without consistent support. This video is not here to judge you. It is not here to shame you. It is here to slow you down before you make decisions that can quietly harm you and your baby. Pregnancy already changes your body, your emotions, and your future. Being pregnant while carrying everything alone multiplies that pressure. And under pressure, people often mistake survival behavior for strength. One of the most dangerous things single pregnant moms do is ignore their own bodies in the name of being strong. They work through pain. They dismiss warning signs. They normalize exhaustion and stress because they believe this is what responsible adults do. But your body is not a machine. It is a communication system. Pain, dizziness, extreme fatigue, headaches, bleeding, breathlessness, or a constant sense that something is wrong are not inconveniences. They are signals. Ignoring these signals does not make you resilient. It delays help. And delayed help during pregnancy can have consequences that appear suddenly and without warning. Your baby depends entirely on your physical state. Chronic stress raises cortisol levels. Untreated pain increases inflammation. Severe exhaustion weakens your immune system. None of these things stay contained in your body alone. Strength during pregnancy is not silence. Strength is listening early and acting early. Another mistake that happens quietly is skipping prenatal care. This is often not because women do not care, but because they are afraid. Afraid of the cost. Afraid of judgment. Afraid of being asked questions they are not ready to answer. Some women tell themselves they feel fine, so doctor visits can wait. But many serious pregnancy complications do not announce themselves clearly. High blood pressure, gestational diabetes, infections, and fetal growth problems can develop without obvious symptoms. Prenatal visits are not routine formalities. They are checkpoints designed to catch problems before they become emergencies. Avoiding medical care does not protect your privacy or your independence. It increases risk. If money is a concern, public hospitals, community clinics, and maternal health programs exist for this exact reason. Using them is not failure. It is responsibility. Another harmful behavior that has become dangerously common is self-medicating based on online advice. Social media has normalized pregnancy hacks, herbal remedies, and casual medication use. Natural does not mean safe. Popular does not mean tested. Many substances cross the placenta directly to your baby. Painkillers, sleep aids, herbal teas, weight loss products, and supplements can interfere with development in ways that are not immediately visible. Someone else's experience is not evidence. Your pregnancy is not a trial run. Every medication or supplement should be discussed with a qualified professional. Food is another area where stress creates silent harm. Some women eat very little because anxiety suppresses appetite. Others rely entirely on fast food because it is affordable and convenient. Both patterns matter. Nutrition during pregnancy is not about perfection or trends. It is about consistency. Protein, iron, folate, hydration, and regular meals support organ development and brain growth. You do not need expensive diets. You need enough. Feeding yourself is not selfish. It is foundational. One of the most emotionally damaging choices many single pregnant moms make is hiding the pregnancy completely. This often comes from shame, fear of judgment, or fear of rejection. But secrecy delays support. You do not need to announce your pregnancy to the world. But you do need medical care, legal awareness, and at least one safe point of contact. Isolation increases vulnerability. Silence removes options. At this point, it is important to pause and understand something clearly. None of these mistakes come from bad intentions. They come from fear, pressure, and the belief that enduring suffering quietly is the only option. It is not. In the next part, we will talk about emotional and psychological mistakes that affect both you and your baby long before birth. We will talk about financial decisions that feel practical in the moment but create long-term stress. And we will talk about relationship choices that can place you in unsafe situations under the illusion of security. This conversation continues because your safety matters. Emotional health during pregnancy is often treated as optional, especially for women who are already under social and financial pressure. Many single pregnant moms believe that emotional pain is something to deal with later, after the baby is born, once life becomes calmer. But emotional stress does not wait. It operates quietly in the background, influencing sleep, appetite, decision-making, and even physical health. One of the most common emotional mistakes is believing that stress is harmless as long as you are coping. Chronic stress does not always look dramatic. Sometimes it looks like constant worry, shallow sleep, irritability, or numbness. Over time, prolonged stress affects hormones that are directly involved in fetal development. It can increase the risk of premature birth and low birth weight, and it can weaken your immune system, making pregnancy harder than it needs to be. Another emotional mistake is isolating yourself completely. Some women withdraw because they do not want pity. Others withdraw because they are afraid of criticism. Some withdraw because they believe that handling everything alone proves strength. But isolation removes perspective. When you are alone with your fears, they grow louder and more convincing. Small problems feel unsolvable. Dangerous situations feel normal. You do not need a large support system. You need at least one safe, informed connection. This could be a healthcare provider, a counselor, a trusted family member, or a support organization. Emotional support during pregnancy is not a luxury. It is preventative care. Many single pregnant moms also carry guilt, even when the circumstances were not fully in their control. Guilt leads to self-punishment. It shows up as denying rest, accepting mistreatment, or ignoring personal needs. Guilt convinces women they deserve less care. This belief is harmful and false. Pregnancy is not a moral trial. Your body and your baby do not benefit from punishment. Financial decisions made under stress are another area where long-term harm often begins. Some women quit their job suddenly out of exhaustion or emotional overwhelm, without a plan or backup. Others stay in unhealthy work conditions because they are afraid of instability. Both extremes come from the same place: fear. Financial planning during pregnancy does not require perfection. It requires realism. Knowing what support programs exist, understanding maternity rights, and creating even a basic budget reduces anxiety. Uncertainty increases stress. Information reduces it. Another common financial mistake is overspending on unnecessary baby items due to emotional pressure. Marketing often targets fear, convincing mothers that love is proven through purchases. In reality, babies need safety, warmth, nutrition, and care. Many items marketed as essential are optional. Financial stability contributes more to your child's well-being than expensive products. Relationship decisions during pregnancy require special caution. Many women feel pressure to rush into or stay in relationships for the sake of the baby. The fear of raising a child alone can push people to ignore red flags. Emotional manipulation, control, and even abuse are sometimes tolerated under the belief that having someone is better than having no one. This belief is dangerous. A stressful or unsafe relationship does not provide stability. It introduces chaos into an already vulnerable time. Stress hormones, fear, and emotional exhaustion affect both mother and child. Staying in an unhealthy environment does not protect your baby. It exposes them to tension from the very beginning. Another relationship-related mistake is trusting verbal promises without practical follow-through. Support is not defined by words. It is defined by actions, consistency, and responsibility. Relying entirely on promises without legal, financial, or logistical security places you in a position of risk. Online spaces can also create confusion and harm. Comparing your pregnancy journey to curated images of others leads to unrealistic expectations. Influencer narratives rarely show hardship, complications, or emotional struggle. Comparison increases shame and dissatisfaction. Your experience does not need to look inspirational to be valid. Misinformation spreads quickly online, especially around pregnancy. Advice given without accountability can sound confident while being dangerously incorrect. Medical guidance should come from trained professionals, not trends. At this point, it is important to understand that none of these mistakes define you. They are common responses to pressure, fear, and isolation. Awareness is not about blame. It is about protection. If you are pregnant and recognize yourself in any of these patterns, the most important thing you can do is pause. Pause before pushing through pain. Pause before making permanent decisions under temporary stress. Pause before believing that suffering silently is the same as strength. Your well-being is not separate from your baby's well-being. They are connected. Caring for yourself is not selfish. It is necessary. This video exists to interrupt harmful patterns early, before they turn into emergencies. You deserve support, clarity, and safety during this period of your life. You do not have to earn care by enduring pain. If this message reached you at a difficult moment, take it as a sign to slow down and reassess. Seek professional help. Ask questions. Choose safety over pride. Brave beginnings are not defined by perfection. They are defined by awareness, protection, and informed choices.